I'm Dr. Natasha Iyer. On the way to work today, there was this lovely ad talking about mental health. And as we all know, it's a big deal, right? Almost everyone's been affected by something to do with mental health. And, you know, in traditional psychiatric terms, we talk about an adjustment disorder with low mood or anxious mood or whatever, and then when that lasts longer, it becomes some kind of illness. There's everything from obsessive compulsive disorder to bipolar to schizophrenia, and no one really has talked about it before because of the stigma attached and the concern, what will happen if. Now, again, we're talking about an illness and then the drugs that fix it. We want to have all this awareness and we want to talk about that, but at the end of the day, how do we treat mental illness today? We treat it with drugs. We treat it with antidepressants, and when they don't work, we add more. And we treat it again with more drugs and more drugs. And have you noticed that most people on an antidepressant have significant side effects? They have fatigue, weight gain, drowsiness. It doesn't really work at the dose. And so really what I wanted to talk to you about today is what's missing from the discussion. And what's missing from the discussion is all of this new science that has to do with the brain. Did you know that there's something called the second brain? The second brain is a whole new nervous system that's been discovered between your gut and your brain that has nothing to do with your spinal cord and all the nerves that we learned about for years and years and years. This second brain is a direct connection of nerves from your gut to your brain. Your serotonin is made more in your gut than your brain. GABA, your calming brain chemical, is modulated by the bacteria in your microbiome in your gut. Your brain chemistry is made of building blocks that come from food. So how you feed your body is critical. What you put into your body, as I've always said, food fuels your health, or it can feed disease. So which would it be? So in the mental health conversation, are we talking about eating pure, wholesome food? Are we talking about eating high quality protein, which gives us the amino acids that gives us the building blocks for brain chemistry? But here's something even more critical. How you feed your body can manipulate and manage your microbiome, which determines how your brain chemistry is balanced and made. More important than that, how healthy your gut is affects how healthy your brain is. More of your immune system is found in your gut than anywhere else. And when your gut is inflamed, your brain is inflamed. So we can feed our microbiome to manage our brain chemistry and our mood. And I think you know this. Why does sugar and food dyes affect children? It's food affecting mood, right? So noting that our microbiome is critical, that this whole talk about leaky gut leads to a leaky brain because it's all connected, and whatever's affecting your gut is affecting your brain. Key foods would be probiotic-rich foods like fermented foods, or supplementing with a probiotic is what I prefer, because then we can pick what your body needs. Good fats. We've all been told over the years to avoid fat. Well, your brain is mostly fat. More than 60% of your brain is made of fat. So you want to eat your good fats, avocados, coconut oil, nuts and seeds. You want to make sure that you take your omega-3 fatty acids. There's studies that show that people who do moderate exercise and take omega-3 fatty acids have the same response in their mood as taking an antidepressant. So there's clinical studies to show us that not taking an antidepressant but doing something good for your health can give you a similar benefit. Now, I'm not saying to you that people don't need drugs. I'm saying that in addition to looking at that, start doing all of these things so that drugs are not the mainstay of what we're using to treat this disease, okay? And now here's my thing. I have a strong family history of mental illness, and I won't go into details about that, but know this. Your genetics are not your destiny. Just because you have that, you can choose otherwise. So what are the genes of mental illness that I want to talk to you about? Not the ones you're thinking about, not a gene for depression or something, but these are genes of detoxification. And all for the last few weeks since I started making you videos every day, I've been going on and on about toxins. Why is it? Because of that gene I mentioned that more than 45% of the population have, that doesn't allow them to methylate and doesn't allow them to process out toxins. Now, if you can't methylate out toxins, you also have trouble doing this process of methylation, which is critical for brain chemistry. And so the higher your toxic burden, the more SNPs you have, or the genetic derangements you have for detoxification, these will affect your brain chemistry. So what if you're not actually depressed? What if you're not actually anxious? What if it's all about how you're healing your gut and feeding your body, and how you're methylating and processing out toxins? In our practice on a daily basis, we are getting people off of their antidepressants by restoring their gut function, by feeding their body the fuel that it needs, by giving their body the building blocks it needs to make healthy brain chemistry. And a lot of the time, it's those two things and then managing stress that can help you reduce your needs for medication or get off of it. Now, it's not as simple as that. I don't urge you to run out and stop your antidepressants. Please get me loud and clear. I'm urging you to put the lifestyle choices in place, expand your knowledge in this whole gut-brain connection, expand your knowledge to know that there are genes that determine how your body responds to things, and that you have control how they express themselves. And how your genes express themselves is up to you, and the biochemical environment you create inside of your body. And then work with your doctor. Now, I'm going to talk about the Metabolic Reset Program again, because we cover all of the foundational steps, and then we have a whole module on brain chemistry, cravings, fatigue, fogginess. All of these things are affected by how we look after our body. And so through the Metabolic Reset 101, I've added in that part because I know how important the brain is. And I also know that your gut and your brain are connected. So I hope this helped you think about mental illness in a different light, and that it's up to you how much better you can make it, and that there's other things to know instead of just drugs and therapy, which I absolutely agree are needed for people. But what else can you do? And I urge you to do more than just take a drug and get therapy. And yes, if you know anyone in your life who's struggling with a mental illness, this is not the time to judge them. It's now that we get to talk about this and say, hey, did you know? And yes, I'm here for you. So that's my thought for today on Let's Talk. Let's talk about mental illness and some of the other things we're doing on a day-to-day basis that are affecting our mental health. Stress, overcommitting, taking on far more than we need makes us depleted in all of the essential nutrients that are needed to make brain chemistry. So again, what's happening in your body chemistry is affecting what's happening in your brain. As you're getting depleted here, you're getting depleted here, and everything's connected to everything else.